15 million deaths is nothing.
But we can do that for the Holocaust too. You mean 6 million people is nothing.
If you want to help prevent bad outcomes from COVID, go to Costco and buy some nicotine gum. I regret getting the vaccine because I think.
Oh, okay, interesting.
Yeah.
Okay.
So, before the vaccine came out, I was in support of it. Blah blah blah. But this is like one of these personal experience things where it's really powerful.
And I think your comment that murderers are composed of Democrats is wrong. I worked in a prison, or I interned in a prison. They're all freaking right of Trump.
The reason why you say I'm wrong is because you went to a jail and your personal experience was that everybody can hear what you're doing, Doug. You cannot go by personal experience alone. You cannot say X is true because I've experienced X happen to me. It's a bad way at arriving at truth. Before the vaccine came out, I was in support of it, blah, blah, blah. But this is like one of these personal experience things where it's really powerful. I'll start with 3 members of my family, personal family. Now, you can't prove this, and I'll admit this, but there's pretty strong correlation to the timing and all this. My nephew had major heart problems after his second, or was it third dose. So much so that he had a heart monitor on 24/7. So anyhow, that's that. My sister almost went crazy with fear. My other sister, to this day has constant allergic breakouts of hives and stuff, to the point where it blisters and bleeds, and it's unbelievable, painful and irritation and just terrible. And then for me personally, a month or 2 after I got my second dose, this happened last year, I had, number one, a horrible experience with it, hallucinated, like not just felt bad, I hallucinated like I was on Percocet. And I've been on Percocet before, and I know what hallucinations are like. I hallucinated on it, and then over the next, and even to this day, have had extreme problems with my extremities, like tingling sensations. And then a couple months after that, in fact, it was right after a live stream, I thought I was going to have a stroke.
Oh,
yes.
Okay.
And
Wow.
and to this day, I'm still not quite right. Like,
What vaccine did you get?
I'm constantly Pfizer. I'm constantly headachy. I'm constantly unbalanced in my, like when I walk. It's like I have to focus to walk. I've been to 3 or 4 different specialists. Nobody can figure out what's wrong. I look healthy on paper, and nobody knows what's going on. Now, can I prove this has anything to do with the vaccine? No, but my suspicions it is.
We today were trying to make it so that every car had seatbelts. We wouldn't be able to do it. These motherfuckers wouldn't let it pass. I knew somebody that had a seatbelt on and they died because they were locked in their car and it caught on fire after a crash. I knew somebody that had a seatbelt, they got in a crash and they still died anyway. It's not effective. I knew 10 people that got in car accidents, none of them wore seatbelts, they got out just fine. Like, dog, there are 330 million people or whatever in the United States. You can find a stupid fucking story for literally anything.
I have seen a little boy healed of an incurable disease by Jesus, and he might have died if,
well,
you know.
I can, Rebekah, I'll speak for myself, but I probably am speaking for a lot of people when I say none of your stories impacts us.
Yeah.
And here's why. Because you're talking about stuff that can be easily explained in other ways. Maybe not easily, but in other ways.
It could be the case, for instance, that I get a vaccine and I'm very worried about it, and then I go and I report to the hospital like, oh God, I'm having chest pain. I think I'm going to die because I watch too many Alex Jones videos or something, but you don't actually have any of these symptoms, or rather you might have like a symptom, but it's like psychosomatic, it's just in your head. You don't actually have like heart damage or anything. Not to say that it's not worth looking into, of course, but I mean, like, again, like there should be a study on this or something if there is like all this heart damage being caused by these vaccines. Again, the FDA and other people that are looking at these long-term studies are looking for stuff like this. I've been to 3 or 4 different specialists. Nobody can figure out
what's wrong. I look healthy on paper, and nobody knows what's going on. Now, can I prove this has anything to do with the vaccine? No. But my suspicions it is. Hang on. There are actually studies out there, and you can poo-poo it all you want. I don't care because I'm not married to it. But there's studies out there that says nicotine actually helped or it bettered the outcomes for with COVID. I think the Chinese did this study. They noticed that people going into the hospitals with COVID, most of them didn't smoke. But China, apparently there's a lot of smokers, way more in the United States per capita. And going, why aren't there smokers coming in? You would think this is a respiratory disease. You would think smokers would be dying the fastest, but they weren't. Something was weird. And now some theories are that the nicotine molecule actually blocked, I think, somehow the COVID virus. Can you imagine saying, hey, everyone, if you're obese, hey, lose weight. That will help with COVID. But you know what? If you want to take up smoking, actually, no, don't take up smoking. If you want to help prevent bad outcomes from COVID, go to Costco and buy some nicotine gum.
First of all, your reaction to this headline, because it is quite shocking and could be misunderstood. What is the science behind this?
Yes, I agree with you. It's quite shocking. And I have to say that smoking kills 8 million people every year in the world. And also smoking is the #1 cause of the lung cancer. So smoking is damaging the alveoli cell line in smokers. So these people have underlying chronic lung disease like COPD. And also most of the smokers have poor pulmonary function. So most of the observations which were done in China, North America and Europe showed that smokers are having really bad cytokine storm in the intensive care unit and with COVID disease. And death rates of the smokers in the ICU are 13 to 14 times higher than non-smokers. So this is very important observation. Therefore, I am very cautious about the Chinese and French observation saying that patients who are admitted to hospital and ICU 4 to 5% compared to people who are released to home. Okay. The rate is 25 to 30%. So this is a very tricky issue. So I am very cautious about this French study. There are a couple of problems with this study. I have to say, #1 is cigarette contains not only nicotine, but also contains more than 22 harmful chemicals. The #1 confounding variable. #2 is the age adjustment is really important. You are just comparing here people who are admitted to hospital in the Europe. In fact, the median age of those people are 62. And the people are released to home, the median age is just 30 to
Dr.
50
Tanner,
years old. So you cannot compare
I want to
apple and
interrupt, and just for the sake of clarity, because there could be a lot of confusion with this study and this headline, what are the risks of smoking given that the coronavirus attacks the lungs?
Well, the most important thing is here, most of the smokers are having chronic lung disease, underlying lung disease, especially chronic smokers. We are calling a chronic obstructive pulmonary disease, which is COPD. And most of them have poor pulmonary functions. And therefore, we know that COVID-19 is causing really bad cytokine storm and lung damages in patients who are smokers. So the death rate is going up in patients who are smokers, especially chronic smokers. Therefore, smoking is a really big risk factor. And this kind of suggestions and studies may mislead people. For me, it's quite shocking. I think somehow World Health Organization has to interfere with this kind of studies because these studies are problematic and you cannot get any positive results. And I have to say that this kind of study has to be done people who are smokers and more than 60 years old who are admitted to ICU. So you have to make comparison, smokers versus non-smokers, but more than 60 years old.
Okay.
But you cannot compare different age groups. So this is not acceptable in the epidemiology and statistical wise.
Like two different ways we can do studies. We can do retrospectives or we can do prospective. Now, when we do a retrospective, we're like, basically we're trying to find like a whole bunch of people that have already been treated. And then we're like, okay, let's see if we can look at all these people that have been treated, and we're going to try to figure out like what the differences were between the people that took this medicine and the people that took that medicine. But the problem with retrospectives is that we can't put in any controls to make sure that we're comparing very carefully one drug versus another standard of care. So here's one big problem. Let's say we go into a hospital and let's say that 50 people took ivermectin and 50 people didn't, and the 50 people that took ivermectin all were cured and the 50 others like died, right? Now we can say with that retrospective study, holy shit, ivermectin was amazing, but it might be the case that because we're doing a retrospective, maybe the 50 people that got ivermectin were just really wealthy people that could afford better quality care. Maybe the 50 that couldn't were poor and they just died because they had like shit healthcare. This is the problem with retrospectives. So ideally, when we do medical studies, we want to do something called a prospective. So a prospective means that right at the beginning, we've already picked all of our patients. And then ideally, we do this in a double-blind way. That means the patients don't know the medicine they're getting and the doctors don't know if they're giving real medicine or a placebo. And then with all the other conditions held the same and the standard of care being equivalent, we track those patients from day 0 all the way past their treatment and recovery to see if our drug actually truly worked when we were controlling for everything else versus the standard of care. This is issues we had in the past with hydroxychloroquine studies, is people would always try to use these retrospectives, but the groups of people that they're polling, it's really, really hard to make sure that all the groups are the same. It might be that some hospitals were really wealthy, they could afford exotic drugs or ivermectin, and other hospitals were really poor and they didn't have anything. They didn't have good ventilation, they didn't have any, even their standard of care was poor. So this is why retrospectives are kind of bad to use in these like medical examples. But that's what I say when I mean like, this is why like prospective double-blind studies are kind of like the gold standard when it comes to figuring out if a medicine is working and making sure we're not just like selecting for groups that were more likely to survive anyway.
I would have shamed fat people, but I would not have shamed people who are willing to try harmless alternatives under the supervision of their doctor, like ivermectin. So let's assume ivermectin does absolutely nothing for COVID. Who cares? Let them take it. Let's say vitamin C, taking tons of vitamin C or vitamin D, absolutely had no good effect for COVID. Let them take it. Don't shame them. But there are good, I think there's some studies out there, and even the country of Japan, I think, used ivermectin and encouraged high doses of vitamin D and C.
A new study on ivermectin shows the drug does not reduce hospitalization from COVID-19 infection. That's according to a new peer-reviewed study published on the New England Journal of Medicine.
Yeah, you might remember the anti-parasitic drug gained popularity in some circles as a treatment for COVID-19, but the study found ivermectin isn't effective in battling COVID like many anti-vaccine advocates promoted.
What he says is ivermectin allowed as a treatment on August 13th is I think it was a speech that was picked up in some news organizations by Dr. Ozaki, who's chairman of the Tokyo Medical Association, except to say that Dr. Ozaki was saying that people should be able to get ivermectin and that perhaps they could get it through off-label prescriptions, they could have it imported, and so on. So let's look at this question. Who is Dr. Ozaki and who is the Tokyo Medical Association? So the Tokyo Medical Association is a private medical professional organization, kind of like the American Medical Association, except it's regional. It's really for Tokyo and for the region around Tokyo. It's a child organization of the parent organization, which is the Japan Medical Association. Now, the Japan Medical Association didn't say anything about ivermectin, and the Tokyo Medical Association has no policy-making authority. In fact, neither does the Japan Medical Association. So it didn't have the authority to allow ivermectin as treatment.
So there are some studies out there that say that there is positive effects, but even if that's not true, like who cares? Vitamin D can be a little dangerous if you take too much, but vitamin C, no. You can You could drink buckets of vitamin C and it's not going to kill you.
I have seen a little boy healed of an incurable disease by Jesus.
We can all agree, for sake of argument, that it's false, that her beliefs are false, but it could benefit people too, right? Despite its falsity.
Yes, I agree. It can, like the examples you gave, Rebekah, of people feeling better for a time. I don't doubt that. I bet you all of us here agree that people do feel better after you pray for them, and in some cases. But when someone, like the point that I made to Camille, if someone truly believes they've been healed, why ought they go to the doctor? Like, seriously, I'm feeling good. Why should I go to the doctor now? If someone thinks they've been healed when really they haven't, it can cause major problems.
Yeah, I mean, I understand your perspective, and I did not know that this topic was going to be this triggering for Nathan's audience. I really didn't, and I probably wouldn't have brought it up.
What's your guess? What's your guess why it's triggering?
Well, I mean, there's a lot of hurt and pain clearly surrounding this. I mean,
but what's causing that pain and hurt?
Well, probably disappointment, like with Aaron is expressing disappointment and the physical harm that has actually been caused to her by this, you know, expectation.
People died because of this. People have died believing that they're healed of something that they're not healed of. It's dangerous.
An anti-vaccine police captain who was taking ivermectin to combat COVID-19 has died of COVID-19. This is being reported by Yahoo News. A Georgia police officer who frequently posted anti-vaccine messages on Facebook and took an anti-parasitic drug instead of a vaccine has died of COVID-19. Captain Joe Manning, 57 years old. Remember, we're not talking about 80-year-olds here. Last guy, Mark Bernier, was 65. This police captain was 57. Captain Joe Manning, 57, of the Wayne County Sheriff's Office, died on Wednesday after a short battle with the virus. Sheriff Chuck Mosley said Captain Manning was an integral part of our family, and our hearts are broken. Our love and prayers go forward to his family. Would have been nice to include a get the vaccine, keep your families safe. After the announcement of his death, Facebook posts made by Manning circulated on social media. He posted a couple of different things, summarized here by Ken Klippenstein. I am not vaccinated by choice, and that's my right. Okay, folks, Wayne Feed and Seed has some liquid and paste ivermectin. Get it while supplies last. He was promoting ivermectin, and he has now died of COVID-19. He left behind kids and a widow. And at least as far as the kids are concerned, this is not their fault. And now they are left without a dad. Are these stories unique? They are not. Is this, at the end of the day, finding out the hard way? We knew what to do. We knew how to do it. The vaccine was free to him, and he didn't get it. Now, with any individual case, and this is always the important thing, you will have people who will come back and say, but David, can you say for sure that if this particular individual had been vaccinated, he would have survived? And of course not. Nobody is saying that. What we do know is that being vaccinated dramatically reduces the odds that you end up very, very sick or dying. And at a population level, not necessarily William Hartman, but at the population level, we know what there is to do. And part of this, you know, I hesitate to use this term, but there's a very specific way in which it makes sense. These unvaccinated COVID deaths, when these are just choices not to get vaccinated, often because of false beliefs about the vaccine, these are wasted, these are pointless deaths. And what I mean by that is, if you didn't do the simple thing that would likely prevent you from dying, not guaranteed, but likely, you didn't do it, then it's very stupid to die in this way, in the sense that just getting a free vaccine might have kept you alive. This is not merely a self-resolving problem we can look away from. What I mean by that is, as we've said before, if this is just as simple as only the unvaccinated will die as a result of them not getting vaccinated, we could look away and say it's sad, but at the end of the day, it's your own funeral. But it's a contagious disease, and we don't know how many people did William Hartman infect. Maybe some were too young to get vaccinated. Maybe some were vaccinated but were very sick. So in getting COVID and dying, how many other people might he have taken down with him? And of course, we don't know the answer, but that's the reason why we can't simply look away and say, well, who cares if anyone gets vaccinated? I did, and I'm now protected, and it's as simple as that. It is a communicable disease, and the behavior of these people affects others as well. So
one side is mortality of COVID, which the number is on a global level. So far, it's 6.5 million, maybe a bit less, maybe a bit more over that, but let's say 6.5 million. But that's just counting the direct deaths, or like people who died, had some complications because they got COVID. But actually the total number of deaths is around 15 million.
15?
Because 15 million, yes, due to the overloading of healthcare systems, because people couldn't get healthcare for other stuff that they
Okay. So
could
let's
have
talk
gotten
about
if there
that.
was no.
Let's talk about that. I'm going to try to shock you. Is that all right?
Okay.
15 million deaths is nothing.
I mean, sure, that's a view.
That's not a view. That's a fact in comparison to the total population. How many people live on the planet?
No, but like
how many people
compared
live
to
on the
what?
planet, Zeleny?
But we can do that for the Holocaust too. I mean, 6 million people is nothing. How many people live on the planet?
Okay,
like,
very
who's gonna
good
take
point.
that argument? You know.
Very good point. But we didn't shut down everything because of the Holocaust, right?
I think America like sent a bunch of their people to fight and like put women and black people for the first time in the like mainstream workforce.
World War II wasn't just about the Holocaust. It was about Hitler taking over the world, not just killing Jews.
It's undeniable that the United States played a significant role in the victory of the Allies. But would the Allies still have come out on top without their American pals? There's a good deal of disagreement on this point, but the prevailing belief seems to be yes. Many believe that Russia was just too powerful to overcome, and that they simply would have swung through Germany and overtaken them had the war lasted longer.
Even in 1941, the Red Army outnumbered them by 4-3 in manpower, 3-1 in aircraft, about 3.5-1 to tanks. And yet, and in fact, in the first year of the war, first 6 months of the war, the Red Army suffered 4.5 million men killed, wounded, and captured. That's 150% of the size of the invading force from the Axis. So it's not about just being outnumbered. It's about the other advantages the Germans have. Not only did they achieve strategic surprise, and we could spend all night talking about why Stalin was surprised, let's not please, but not only were they surprised strategically, but also the Soviet army was caught in transition. They were changing their leaders, their organization, their doctrine, their training, their locations for defense plans. Everything was in flux just when the Germans chose to attack. The Germans could not have chosen in the short run a better time to attack. And that is the reason, the principal reason why they were so successful. Now, a year later, you fast forward to the middle of 1942, and by that time, it's been sort of the Darwin Awards. Those surviving Soviet commanders know what they're doing. And suddenly, the Germans are not nearly so successful. The second fallacy is not so much that they were outnumbered. They knew they were outnumbered, didn't they? They must have. But rather the belief that on part of the Germans that it really didn't matter. It doesn't matter that we're outnumbered. We're still so good we can defeat the enemy so rapidly that numbers don't matter. I seem to remember something like that in 2003, but let's not go there, right? And it works in the short run. It just doesn't work in the long run. In any event, Germany, in fact, is the poster child for what we like to call the Western way of war. The idea that a well-trained force can achieve rapid, offensive, decisive victory by superior discipline, maneuver, and equipment. Well, that works part of the time. But if you encounter somebody who is not willing to say he's defeated, as the Soviets were not, and then you encounter somebody who in addition to that has all that vast terrain, then eventually your plan gets thwarted. And
so what would have happened if the United States never joined World War II? The Axis still would have been defeated, but the cost to the rest of the world likely would have been considerably larger.
Can we bear 200, 300,000 people a year dying from a coronavirus? We can. It sucks. It's like 10 times more than the flu, but we could bear that. But could we bear like 100 times more? If we were losing like 6 million people a year? No, that's like way too much,
you know, I think we say these numbers, but I think we also have to also be honest about the fact that at some point this kind of thing tops off, in the sense that there's only so many people who are going to be susceptible to the virus. It's not like the whole population. So this is not something that can exponentially rise into infinity. There is a cutoff point where this virus doesn't affect a lot of people.
Sure.
You know, so I get the whole idea of exponentiality, but even the people who are susceptible to dying to the flu, it's not like if everyone got it tomorrow, this thing would just skyrocket into the moon. Most people are going to just be perfectly fine from suffering for it. So yes, do I agree that the figure was probably low? Sure. But I don't think it's nearly as much of a threat to vast majority of people as people as the figure or the kind of picture that you were painting would say.
Well, yeah, because the majority, when I say like could 5 million die, that's going to be mainly old people or people with like multiple comorbidities, right? So younger people, maybe who are like obese with asthma and, you know, some other type of heart condition, congenital heart condition, whatever, for sure. The two things that worry me are, one, that every time you have another person that gets infected, it's an opportunity for the virus to change sufficiently enough that it could reinfect another person that previously was safe. And then two, the long-term effects are still something that we don't know 100%, because a lot of people are dealing with, like, they call it long COVID, where you kind of have these like this higher proclivity for like blood clots to form in the brain that a lot of people are seeing, or for these like cardiovascular issues to pop up. And, you know, like the death rate among younger people is very, very low. It's like a fraction of a percent. But if like the long-term health you know, defect or whatever, if that number was like even like 1 or 2%, that kind of sucks. That like if you have like
a lot of people,
if you have like for every 100 young healthy, because people in their 20s shouldn't have blood clot problems or heart problems or whatever, and if you're getting that because of like a coronavirus that now becomes endemic and is seasonal, man, that would really suck. It might be unavoidable at this point, but what a shitty world to live in. If it was avoidable.
Yeah, I think it's unavoidable. I think it's unavoidable. There's no way you're going to get the whole world vaccinated enough to kind of keep this stuff, and considering how highly contagious it is, that's the main thing. And its evolutions. The whole world could get everything well situated, and then some dude in Peru who, you know, lives out in the rural area gets some kind of fucking variation. It spreads through Peru like wildfire. It's going to escape Peru because you can't shut anything down nowadays, especially with how contagious it is. And then it just spreads again, and we have a whole new wave. I think considering how contagious it is, I think it's over. This thing is here to stay.
But if even if that was the case, I think that in one world, maybe with social distancing plus like a 90% plus or whatever vaccine rate, maybe we can like actually get rid of it, or at least get it to very minor outbreaks. But in the other world where it's here forever, I think in that world, I think there's an even stronger argument for everybody getting vaccinated. Because if we are going to be having like tens of millions or over 100 million infections in the US every year, at the very least, the vaccine gives you this like 95% protection from like serious hospitalization. Because that's the next problem that people are having, is that like, even if there aren't a lot of people dying, now all of our fucking hospitals are filling up. And man, if my kid had an issue where he needed to go to like an emergency room or an ICU, and it was full of unvaccinated people like taking up beds, I would be so unbelievably mad. And if you're starting to hear more and more stories of like some of these ICUs filling up, and it's like, whew, that's a really scary place to be in. Yeah, so like, man, it's so easy to just get vaccinated.
Well, probably disappointment, like with Erin is expressing disappointment and the physical harm that has actually been caused to her by this, you know, expectation.
People died because of this. People have died believing that they're healed of something that they're not healed of. It's dangerous.
That was almost me.
And I encourage you to stop it. Unless you can demonstrate
one good, like peer-reviewed study for ivermectin as a treatment for COVID-19, like this is experimental. What you're pointing to right now would be experimental because there's no like peer-reviewed data that's supporting the idea that this is an effective treatment. Whereas for the major vaccines in the US that have been FDA approved, there is a plethora of data of long-term prospective double-blind study data that is being used to support the efficacy of those vaccines.
The best way, in my opinion, to lower biases is to you get a whole bunch of biases together, people of different backgrounds, different cultures, and you pour them in a pot and you take a big spoon and you mix all the biases together, and then you look at the evidence and you see, okay, do we agree on X? All these different biases, all these different cultures. And if we do, then you can say, raise your confidence. Well, maybe what we are saying here, what we're seeing here is based on something true.
Right.
I think it's reasonable, especially with how politicized everything gets, like on whether or not we can or cannot trust like the government for certain things. But when I look at like health related stuff, especially from hospitals, when it comes to the vaccine, like I think this is something that has been like collaborated on across multiple institutions. So like the government and like schools and universities and private companies. And it's been collaborated on across multiple countries across the world. So even if like the government in the United States was lying, there's no way that like every other government would also agree to lie like with everybody else, right? Like I feel like there would have been leaks, or you would have seen like evidence of like, you know, Germany would come out and say like, hold on, the United States isn't being truthful for this, or like France would come out and say. So I feel like everybody in the world, like all the governments and all the schools kind of coming together and be like, okay, yeah, like the vaccine is probably safe. I think that makes me feel like a lot more confident in it than just relying on, you know, like the US government for like a source of health information.